So we're all familiar with the traditional clinic-based model for providing preventative care services, where patients go to a healthcare facility, interact with their providers, who then provide health education, screenings, and managed preventable diseases. However, several barriers exist with this traditional approach, many of which were highlighted by Dr. Lin, and were particularly magnified during the COVID-19 pandemic, particularly in communities where healthcare deserts exist. So we developed a community-based mobile care model where we as providers would go to offer these services at community sites that were high traffic and commonly utilized areas of the community, non-healthcare settings, so that we can meet patients where they are and hopefully mitigate some of these barriers. So in November of 2020, before the COVID vaccines were available, we piloted this approach. We started with holding an election day flu shot event at a local church in the South Shore community that also functioned as a polling site. And this was done in collaboration with Walgreens and a community-based organization and was really well received. We then had the opportunity to partner with Mobile Care Chicago, which is a mobile care provider that has several RVs that are basically designed to have 2 examination rooms and a waiting area where we could provide these services in non-healthcare settings. So what we did in this collaboration was we held several vaccination events at a local grocery store, a public school, a church, a community center, again in the South Shore community, initially providing flu shots and later COVID vaccinations once they were available. This work was funded by the Sprague Memorial Institute. Finally, in collaboration with the Chicago Department of Public Health and faculty and students from the colleges of medicine, pharmacy, and nursing, we developed a community-based mobile care program that we called the COVID-19 Rapid Response Team, or CRRT. The focus of the CRRT events was vulnerable populations throughout the Chicago area that basically Dr. Layden and Dr. Lin highlighted in their graphs as well. And so we were targeting vulnerable residents that were typically living in congregate settings, senior living settings, and mixed income housing. Collectively, through these 3 programs, we conducted more than 200 vaccination events early in the pandemic and administered nearly 2,800 vaccines to some of the most vulnerable residents in our city. So fast forward a couple years, and we again had the opportunity to partner with Mobile Care Chicago to develop a community-based mobile care program, but in this case pivoted the focus to cardiovascular wellness, which is my area of expertise. In doing so, we provided health education and screenings for common cardiovascular risk factors at public non-healthcare settings in South Suburban Cook County, and this work was funded by the Cook County Department of Public Health. And so what you can see here is, although we conducted 11 events and screened about 50 residents before the federal government canceled the funding, importantly, I want you to note that more than 70% of the individuals we screened had 1 or more uncontrolled risk factors. And so I share with you these examples as a demonstration for the potential utility of having a community-based mobile care program. Thank you.